Well, speaking of Germany, let's focus on Germany now, which is in the grip of the third wave of the pandemic, and case numbers there are rising steadily as the country fails to get new, more aggressive variants under control. Debates over how to handle the situation may now lead to a political showdown in the country. For more on this, we're joined by DW correspondent Nicole Frolich, who joins us from Berlin. Thanks so much, Nicole, for joining us. Now, German Chancellor Angela Merkel has threatened to centralize the country's COVID response, overriding state leaders on matters of disease control. Why is this?
Well, the situation here is quite extraordinary at the moment, actually, with Germany being a federal republic. Implementing disease control measures is largely up to state leaders. They agreed with the central government that a relaxation of restrictions would be allowed only as long as the case number in each region stayed below a certain threshold. In case of surpassing it, it was agreed that the region in question would automatically go back into lockdown. Now, with cases on the rise again, this critical point has been crossed in a number of states, but not all state premiers are following the agreed plan. And that has angered Chancellor Angela Merkel, who is pushing for a more radical approach to fighting this very aggressive third wave. So much so that she recently announced she's not going to sit idly by while pandemic control isn't taken seriously everywhere in the country. Now, currently, she doesn't have the power to overrule state leaders on this matter, but she did hint at amending Germany's pandemic law in order to regain control. This would, of course, amount to a significant power grab, very unlike her, and would certainly also cause a lot of controversy, but she's not standing for re-election later this year, so she might just do whatever it takes to bring everybody in line.
Now, there's been a very slow rollout of the vaccines, not only in Germany, but around the entire EU. What's being done to speed it up?
You're exactly right. Frustration in the EU is growing each day. Now, efforts in Germany have taken another blow, with the country's vaccination agency deciding that the AstraZeneca jab not be provided to people under the age of 60 after mounting evidence of blood clots, especially in younger women. In the 4 months since the EU's inoculation drive began, less than 13% of the population has received a first shot. Leading the way here is Hungary, and there is a very simple reason for that. They are using Russian and Chinese serums that have not yet been recommended by the European Medicines Agency. So quantitatively, they are ahead, but it remains to be seen at what cost, really, since the data on the safety and efficacy of the vaccines they are using on their population has not been independently verified. A jab that has been approved in the EU is the one developed by the U.S. pharmaceutical giant Johnson & Johnson. Brussels has so far ordered 200 million doses of that single-shot vaccine, the first of which will reportedly arrive on April 19th. So here the European Union, with its 450 million citizens, really hopes to give its vaccination drive a significant boost. But officials are also in talks with other players of the pharmaceutical industry to see where production infrastructure can be improved and the rollout sped up by, for example, relaxing storage conditions or greenlighting new manufacturing sites in the bloc. In any case, vaccine export bans, because we have to bear in mind that millions of doses are produced in the EU and sold and administered abroad, are still an option that is very much on the table. But this kind of vaccine nationalism could have very serious consequences, and the EU isn't going to haphazardly jeopardize international alliances over this.
Well, the EU is now in the middle of the Easter holiday, so what measures are being taken to ensure that, vacations don't turn into super spreader events?
Non-essential travel is still very much discouraged around the EU, and entry from non-Schengen nations is actually banned in most countries. But within the EU, the situation is somewhat bizarre, to be honest. Germans, for example, can't vacation in Germany because lodging for holiday purposes isn't allowed. They can, however, travel abroad, to Spain, for example, where the situation is similarly outlandish. People can enter the country to vacation, but Spaniards themselves can cross from one region to the other for leisure purposes. So there is a bit of bewilderment about this, as you might imagine. Countries that are expecting considerable movements over the Easter holidays have largely imposed negative test requirements for entry. Some have had them in place for quite some time, like Spain. Germany triggered measures quite short notice, which sent some destinations like the Balearic island of Mallorca scrambling to up testing capacities. Italy, another European tourism hotspot, will impose a mandatory 5-day quarantine for people arriving or returning and testing at the end. So there is no unified EU strategy, really. People are urged to use local contact tracing apps and to practice social distancing wherever they go. To make all of this easier in the summer, the main holiday season here in Europe, the EU is looking at launching a green pass in June, aimed at facilitating travel for those who have been vaccinated or already recovered from an infection. But this plan, too, is not without controversy. Critics say that this kind of passport would discriminate those who haven't been able yet or maybe don't want to get vaccinated.